Well, hello there. It's Dr. Brian McKay, not just a chiropractor at Stanford, Darien, Norwalk, New Canaan. Again, as always, apologizing for that really terrible name for a podcast, but I hope you find it interesting and maybe you're learning some stuff. Anyhow, like I said, I'm a chiropractor, practicing Darien, Connecticut. Love what I do, love helping people. This time of year, we start to see people exercising, which is great. I mean, do you ever stop exercising? Well, probably the day you die is when you should stop exercising, but that's this time of year, we get people who really want to exercise, but they can't exercise. They can't lose the weight because they've got knee pain. So what happens in that case is you got to fix the knee pain. Otherwise, the exercise program is not going to work, and you're not going to lose the weight because typically you need to. I mean, diet's a great way to lose weight, but it's not as effective as when it's done with an exercise protocol and one that where you make lifestyle changes for good. Because once you stop exercising or stop dieting, you're going to put the weight back on. So we fall back into our old bad habits. Usually another week or so. You get the first 3 weeks, you do pretty good, and then all of a sudden it's like, what can I do to really mess this up? So anyhow, what happens with the knee is you're heavy, and it makes the knees worse. I mean, obesity is going to be one of the problems with knee pain anyhow, but you got a couple different problems here. Chances are you're not eating well. That's a whole nother topic. But I want to touch upon the protocols that we use here at Core Health in Darien, and it's the protocol we use to address the knee. And the foundation is this specialized therapy called the Neon Track. The Neon Track is a specialized traction unit that helps your knees produce more synovial fluid. So you know how your car needs oil to run an engine efficiently? Well, your knees really require lubricant in the form of synovial fluid to run efficiently. It kind of lubricates the joint, makes it easier for your femur to work against the tibia. The fibula really doesn't get involved that much with knee pain. I mean, it can if you break it or if you dislocate it, but for the most part, it's the femur and the tibia. Femur being on top, and you got the patella connecting the two of them basically through a tendon on the top, tendon on the bottom, superior and inferior patella tendon. So what typically happens is you have a number of different conditions that can respond very, very nicely to the Neon Track. If you have meniscal tears and they're not bad tears that need to be operated on, well, that's one particular thing. But if you have minor tears, minor sprain strains, say that 3 times fast. Maybe it's post-surgical rehab or Baker's cyst, cartilage is wearing away. These are where the Neon Track shines. The Neon Track gently pulls apart the knee joint, okay, separating the tibia and the femur, and it stimulates production of the particular synoviocytes, which help produce synovial fluid. So that's the main the main gist and what I mean. Very few places offer. I mean, as far as I know, I think we're the only facility in Connecticut that offers the Neon Track. So that's it. But there's other things that go into play. We use a pulse wave therapy, and that helps work the muscles and stimulate the production, some stem cell production as well, to help regenerate a tired old knee. And that's a relatively new thing. I mean, we've been using it for several years now, but we really started using it for our plantar fasciitis cases as well as our tennis elbow cases. Anytime you have soft tissue, this really helps break it up. Adhesions that form in the fascia, preventing smooth movement of the muscles against each other. So that's what the pulse wave. We used to call it shock wave, but people aren't really enamored with that term shock wave. It sounds painful, and it really is not that painful to begin with. It's like a tap tap tap. It's a pneumatic device. If you need to know, it originally started with kidney stones. Instead of breaking up kidney stones, that they would lubricate the surface of the skin and break up a kidney stone externally. So what they're doing now is that it got into orthopedics for soft tissue injuries. Podiatrists use it. Some people, even now, urologists are using it for erectile dysfunction. We do not do that here at Core Health. I'm a chiropractor. We really don't work in urological world at all. So that's the second part. Now there's a third part of the program called blood flow restriction. And blood flow restriction is a very powerful way to draw blood into the muscles, and you're going to heal. You're going to heal through blood flow. That's really what it comes down to. It's probably the primary way you're going to heal anything is through blood flow. So what we do is we take these tendons, a band, wrap it around your thigh on the side. Maybe if you have both knees, we do both knees. Rarely do we see two knees at once, but it does happen. And what will happen then is you tighten up this band, and it restricts the blood flow. So when you take that muscles, those leg muscles through a normal range of motion, the body's looking for that extra blood flow and oxygen as well. So there's a little bit of deprivation. So when you take it off after the brief session, I'm talking the initial reps. Okay, say you could lift 100 pounds or push 100 pounds with your legs. You'd only use 40 pounds when you're doing the blood flow restriction therapy. You do 30 reps, 15-second break, 15 reps, 15-second break, 15 reps, 15-second break, 15 reps, and you're done. So it doesn't take long. Once you take that off, the blood goes rushing in, helps healing because it's going to really rush all those pent up nutrients in the blood to that area and help heal the different muscles. Muscles are involved with knee pain. It's not all just mechanical. So this is so far we've identified the knee on track, the pulse wave therapy, and now we're just talked about blood flow. Now we're going to talk about trigenics. Trigenics is a highly specialized soft tissue technique that we use here because most people do not think most people think of chiropractors back and neck doctors. And listen, for the most part, that's pretty true. However, we like to do things differently here at Core Health. So what we do now is we use many soft tissue techniques because they're really effective. You can't ignore. Uh, if I just played did adjusted bones all day, I'd be pretty bored by now, and I probably wouldn't be doing what I'm doing anymore. But I love what I'm doing because there's more to learn, always more to learn, and better ways to do things. So, trigenics is a way of working with special nerves within the tendon and special nerves within the muscle and reintegrating these to the spinal cord via afferent nerve pathways that go to the spinal cord, which then travel up what we call tracks to the brain to receive the information and act on it. So if a muscle is dysfunctional, the brain is not going to get the information it needs from a dysfunctional muscle if these certain nerve cells aren't firing properly. So the trigenics is a method of reestablishing normal neural connection between muscles and tendons to the spinal cord to the brain for correct, nerve intervention on the way back. So that's, and then the next thing we do is we do, of course we do exercises, but a lot of times my thing is to get the person out of pain, restore the structure as best they can, and then send people out for physical therapy afterwards because physical therapy is great, but if we do this first, you're going to have a much better response with physical therapy. So it's kind of like, stick with my specialties, which I'm outlining right here. So that's the basic program that we use for, rehabilitating a knee. And the concern here is it's really hard to lose weight, very hard to lose weight. It's more difficult to lose weight if you can't exercise and diet at the same time. Here we are in January 2023. Everyone is obviously ready to exercise and get their game on, but it's really not that. It's not easy. I mean, losing weight is difficult enough on its own, so you have to change your habits and exercise. When you combine exercise and diet together, there's a greater likelihood that you will be able to lose the weight. And my what I'm encouraging you to do is if you have a knee problem, take care of the knee problem first because you got to start slowly. And if you start and you're achy all the time, you're not going to want to finish. And it's kind of beats yourself up and you get back into that pizza beer cycle that really only doesn't really help you. It just keeps you with the weight on, not exercising, not feeling good about yourself. So if you're going to exercise and the knee hurts, get that fixed first and then slowly ease your way into exercise because the exercise, it really needs to be a lifestyle, a permanent lifestyle change in order for you to truly be healthy. And it'll make it easier for you to keep the weight off, especially if you're pain free. The other thing too is you may not be aware, but a lot of times knee pain is something that wakes you up at night when you turn. It stresses the knee, especially if you have the bed sheets too tight. So that's my 2 cents. That's my story. I'm sticking to it. I wish you a healthy, happy 2023. But bottom line advice is if you're having knee pain and you want to lose weight, get the knee pain fixed. Please get that knee pain fixed. You will not regret it. I'm Dr. Brian McKay, Core Health in Darien, not just a chiropractor. Stanford, Darien, Norwalk, New Canaan. Hope you tune in again. Thanks for listening. And you can always reach us if you've got any questions. 203 656 3636. 203 656 3636. Have a great day.